Julius Randle left the game in some serious pain due to a right shoulder upper arm injury that he sustained on this fall while trying to land. In this video, we're going to take a closer look at what exactly this injury could be. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you about the medical side of the sports world. Watching this through in full speed, we'll see as Randle goes up, he comes down and he lands on that right arm with that right arm outstretched. If we wind this up a little and go through in a little bit slower motion, we can see him come up. As he comes down to try and brace his fall, that right arm goes out, he lands almost like a foosh type of injury, except instead of his elbow being locked in extension, which is going to put you at a risk of an elbow fracture or a potential wrist fracture, that right arm, you'll see it sort of extends up forward in front of his head a little bit, and then comes an adduction across his body. So he almost lands in kind of this position, and then as he rolls, he's going to roll around more and land on that right shoulder. This is a really important view because this essentially tells us exactly what we need to know. As Randle is sitting here on the ground, look at the contour that we're seeing in his right shoulder. We see this really sharp contour right there. This is going to be the acromion, and then this flattening of his deltoid is very indicative of one specific type of injury. So comment down below if you know what injury I'm talking about before we finish reviewing exactly what happened. As we can see, of course, Randle goes to get up. That right arm is just kind of hanging down at his side. Again, look at this difference from side to side. We see this flattening over that deltoid on the right shoulder compared to the normal round contour that we see on his right side. As we continue to kind of play this through, of course, Randle is still just letting that right arm hang down at his side. And again, look at this difference, that difference between this sharp, deep contour that we have right here compared to the normal rounded shape of his shoulder. Next, we'll talk about what injury I think this is and the basic anatomy and how we treat it. But first, I want to give a quick shout out to the sponsor of this video. This video is sponsored by Ada. Did you know that there are now treatments available for COVID-19? Yep. And that means if you catch it, there's something you can do to potentially avoid getting really sick. COVID-19 is still a very real risk in our world. And during these winter months, cases can certainly be on the rise, especially as we're spending more time indoors. And that's why it's important to know that you or your loved one could get treatment for COVID-19 if needed. All you have to do is take Ada's free health questionnaire to see if you're at high risk for developing severe COVID-19 infection by clicking the link in the description below. Their free health questionnaire walks you through a series of steps that gets information about you and your health to help them determine if you're potentially at high risk of developing severe COVID-19 and might benefit from specific treatment if eligible. If eligible, you get connected with clinicians in telehealth to learn more about COVID-19 treatment options. Taking care of your health at the start of the new year is just a really smart move. Ada's free health questionnaire is trusted by clinicians to help you understand more about COVID-19, and I can't stress enough as a doctor the importance of proper COVID-19 treatment. I trust Ada to help give you and your loved ones that guidance here at the start of the new year. Thank you again to Ada for sponsoring today's video, and let's get back to our learning. So if you guessed shoulder dislocation or shoulder subluxation, then correct. That's exactly what I think happened here with Randle, especially when we notice this flattening of that prominence of his deltoid. This is a very classic appearance for what we will visually see when an athlete has had a dislocation of their glenohumeral joint or their shoulder joint. We see this very clear asymmetry. Oftentimes that humeral head is displaced forward relative to the socket, and then because of its position, where it's sitting forward in front of the body, you get that flattening of that outer portion of the deltoid like we're seeing here with Randle. And also the mechanism just fits as well as how he's carrying that arm down at his side. This is very classic, kind of textbook appearance and mechanism for what we'll see with a shoulder dislocation. Look at the difference here as we're looking straight on at Randle. We see his left shoulder nice and round, and then as he walks through here, how flat and pointy we see that prominence of the acromion. Again, textbook for shoulder dislocation. Let's look back at the mechanism of how this happened because that explains a lot with the injury. As Randle comes down here, remember he's landing with that right arm out in front of him, and then it gets put a little bit over his head and then adducts across his body. That's going to put him in this stress position where then the head of the humerus wants to go forward. So then as you land on that side, that force of the ground wants to push that head of the humerus even further forward, helping to contribute to that dislocation. Oftentimes people who kind of get with their arm out overhead when they land, that can cause this sudden force that leads to these dislocations. If we look at our biodigital anatomy tool here, let's talk about our shoulder anatomy and then get down to the joint and then what can be injured with the dislocation. So first on the outside are the muscles of the rotator cuff. In the front, we have the subscapularis, up top, the supraspinatus, and then in the back, the teres minor and the infraspinatus. Whenever somebody dislocates or lands on their shoulder, especially as we get older, you can have a tear of these rotator cuff muscles. And so that's important to determine what we do for treatment early on is if we're worried about a rotator cuff tear. It would be unusual for someone younger like Randle to have a rotator cuff tear of significance, but definitely possible and something that the medical staff is going to have to think about. If we then go through here and we hide our rotator cuff muscles, we get down to that glenohumeral or the shoulder joint. Remember, when we talk about a shoulder separation, we're talking about an injury to the AC joint, the acromioclavicular joint right here. But a shoulder dislocation or a shoulder subluxation is an injury right here to this glenohumeral joint between the glenoid, which is the socket on the shoulder blade, and the humeral head. We characterize these shoulder dislocations by the direction of the humerus relative to the glenoid. So if we look straight on from the side, an anterior dislocation is when the ball is forward, posterior is when it's in the back. Anterior are far and away much more common, and I suspect what we're dealing with here on Randle. Now, what can happen when you dislocate your shoulder, and happens at a very high percentage of the time, is whenever the humeral head dislocates and pops out, you can get this shearing injury where you tear the little rim of cartilage called the labrum. This is the labrum. It goes all the way around that socket, and so if we hide the humerus, you get a really good view of that labrum. You can have tears anywhere around this labrum. A slap tear, like you might hear about with pitchers, is a tear specifically up at this portion of the labrum. But even when the shoulder dislocates, you might have a simple labrum tear called a Bankart lesion. You could have a bony Bankart where there's actually a fracture through the bone of that socket along with the labrum tear. And so there's a whole constellation of possible injuries that can occur whenever you have a shoulder instability event. Now, other things to think about here for Randle, of course, people mentioned like he was grabbing the pec area. I would frankly be very surprised if this was any sort of a pec injury. The mechanism doesn't make sense. For pec injuries, you're going backwards where you're loading eccentrically on the pecs. Here, that flattening that we see of the deltoid, very classic for a shoulder dislocation. I would be very shocked if that's not what Randle had. The treatment then depends on, number one, is there anything like a major rotator cuff tear or a fracture? If there is, that's clear you need surgery, especially if it's a full thickness rotator cuff tear. Then it becomes a matter of how quickly you can rehab and how much residual instability you have in your shoulder. Of course, John Morant had a tear in his labrum and had to have surgery, and it's very likely that Randle could have a tear in his as well. But you don't necessarily have to do a surgery during the season. It's possible you can try and rehab them. Might take a few weeks to get that range of motion and strength back on average. But then if you feel stable, you can try and get through the season and then do surgery afterwards if it's still giving you trouble. So this could be dicey here for Randle. If there's a fracture, if there's a big rotator cuff tear, I would suspect him to be done for a while. If there's a fracture, definitely. Then it depends on what degree of instability he has, how extensive the labrum tear is. Expect him to get an MRI. And then it really is up in the air at this point if this is going to be just a few week absence versus something that could end his season. Previous history also comes into play here. If you've had previous shoulder instability episodes, that also plays a role in how we manage these. But shoulder dislocation is what I'm worried about for Randle. Let me know, as always, any questions or comments down below. And until next time, we'll see you later. Bye.